The nurse is caring for a client with terminal cancer. The nurse should consider which factor when planning pain relief. Option A, not all pain is real. Option B, opioid analgesics are highly addictive. Option C, opioid analgesics can cause tachycardia. Option D, around-the-clock dosing gives better pain relief than as-needed dosing. The correct answer is option D. Rationale. Focus on what the question is asking, the factor to consider when planning pain relief, and consider the client's diagnosis of terminal cancer. Around-the-clock dosing provides increased pain relief and decreases stressors associated with pain, such as anxiety and fear. The nurse is caring for a client who just returned from the recovery room after undergoing abdominal surgery. The nurse should monitor for which early sign of hypovolemic shock. Option A, sleepiness. Option B, increased pulse rate. Option C, increased depth of respiration. Option D, increased orientation to surroundings. The correct answer is option B. Rationale. Note the strategic word early in the query and the word just in the event. Think about the pathophysiology that occurs in hypovolemic shock to direct you to the correct option. Restlessness is one of the earliest signs, followed by cardiovascular changes, increased heart rate, and a decrease in blood pressure. The nurse is teaching a client in skeletal leg traction about measures to increase bed mobility. Which item would be most helpful for this client? Option A, television. Option B, fracture bedpan. Option C, overhead trapeze. Option D, reading materials. The correct answer is option C. Rationale. Focus on the subject, increasing bed mobility. Also note the strategic word most. The use of an overhead trapeze is extremely helpful in assisting a client to move about in bed and to get on and off the bedpan. The nurse has reinforced discharge instructions to a client who has undergone a right mastectomy with axillary lymph node dissection. Which statement by the client indicates a need for further teaching regarding home care measures? Option A, I should use a straight razor to shave my underarms. Option B, I need to be sure that I do not have blood pressures or blood drawn from my right arm. Option C, I should inform all of my other healthcare providers that I have had these surgical procedures. Option D, I need to be sure to wear thick meat hand covers or use thick pot holders when I'm cooking and touching hot pans. The correct answer is option A, I should use a straight razor to shave my underarms. Rationale. This question is an example of a negative event query. Note the strategic words, need for further teaching. These strategic words indicate that you need to select an option that identifies an incorrect client statement. Recall that edema and infection are concerns with this client due to the removal of lymph nodes in the surgical area. Lymphadenopathy with associated lymphedema can result, and the client needs to be instructed in the measures that will avoid trauma to the affected arm. A 28-year-old diabetic male has been found wandering around in a confusing pattern. He is sweating and pale. Which of the following tests is most likely to be performed first? Option A, CT scan. Option B, blood glucose check. Option C, arterial blood gases. Option D, blood culture. The correct answer is Option B, blood glucose check. Rationale. With a history of diabetes, the first response should be to check blood sugar levels.